Critical care nutrition for diabetic patients in ICUs focuses on tight glycemic control using specialized tube feeding and insulin protocols. This reel breaks down evidence-based strategies from ASPEN, ADA, and ESPEN guidelines to optimize outcomes. Watch completely for ICU protocols. Critical care nutrition for diabetic patients. ICUs manage diabetic patients with enteral nutrition to prevent hypoglycemia, which affects 30 to 90% on tube feeding and raises mortality risk. Protocols target blood glucose 140 to 180 mg/dl to minimize complications like infections and organ failure. Continuous enteral nutrition stabilizes glucose better than bolus feeding. Glycemic targets in ICU. ADA and ASPEN recommend blood glucose 140 to 180 mg/dl for critically ill diabetics. Tighter control below 140 mg/dl increases hypoglycemia without benefits. Monitor blood glucose every 4 hours on continuous feeds, 7 times daily for bolus oral. Keep variability low, ST plus or -1, using arterial venous samples if capillary unreliable. Continuous enteral feeding preference. Continuous enteral nutrition over bolus reduces glycemic excursions in diabetics. Bolus spikes blood glucose due to rapid carb absorption. Start at 10 to 20 ml/hour, advance to 25 to 30 kg/day with greater than 1.2 g/kg protein. Preferred in ICUs for steady insulin matching and lower infection risk. Diabetes-specific formulas with 30 to 40% carbs from low GI sources, isomaltulose, fructose, 40 to 50% MUFAs, and fiber lower mean blood glucose, insulin needs by 20 to 30%, and infections versus standard high-carb formulas, 55% carbs. Examples, Glucerna 1.5, used in RCTs for ICU hypoglycemic patients. For continuous enteral nutrition, use for insulin infusion initially in unstable patients, transitioning to square, basal, glargine NPH 0.1 to 0.25 units kilogram, plus nutritional, NPH every 8 to 12 hours or RAA every 4 to 6 hours at 1 unit 10-15 g carb, plus correctional. Adjust daily by 10 to 20% based on prior needs. Enteral nutrition interruptions risk hypoglycemia, hold square insulin if feed stop greater than 1 hour, start 10% dextrose 4. Protocols ensure insulin stops with continuous feeds, e.g., RHI in bag for PN crossover. Prevents blood glucose drops below 110 mg/dl.